Welcome to our Research Data Network series. In this episode, we'll be discussing the National COVID Cohort Collaborative, N3C, what it is, and why researchers will want to use it. We will also discuss costs and where you can go for more information. The Clinical and Translational Science Award Program and the scientific community created the National COVID Cohort Collaborative, N3C, to overcome technical, regulatory, policy, and governance barriers to sharing and harmonizing individual-level clinical data during the COVID-19 pandemic. N3C aggregates and harmonizes electronic health record data across clinical organizations in the United States. Data partners include the National Patient-Centered Clinical Research Network, CHINETX, ACRO for clinical trial, and Observational Health Data Sciences and Informatics. As of May 2023, N3C network is at 19 million persons with 76 sites. The N3C Data Enclave is a secure platform through which harmonized clinical data are stored. The enclave includes demographic and clinical characteristics of patients tested for or diagnosed with COVID-19 and further information about the strategies and outcomes of treatment for those suspected or confirmed to have the virus. Additional data from individuals infected with pathogens such as SARS-1, MERS, and H1N1 are also included to support comparative studies. The enclave is equipped with state-of-the-art analytic tools including R, Python, and others. Centers for Medicaid and Medicare CMS data is now linked to the N3C data. The addition of de-identified CMS data is significant to the scientific potential of N3C and will strengthen the overall capacity of the enclave. Data can only be accessed and analyzed within the N3C data enclave and cannot be downloaded or removed. There are three levels of data available for analysis on the N3C data enclave. The first is the limited dataset. The limited dataset consists of patient data with days of service and patient zip code included. Next, the de-identified dataset. The de-identified dataset consists of patient data from the limited dataset with adjustments made to dates of service and patient zip code to protect patient privacy. The last is the synthetic dataset. The synthetic dataset consists of data that are computationally derived from the limited dataset. This dataset resembles patient's information statistically, but is not actual patient data. There are access requirements associated with each data. Click this link for further information. The enclave is a great resource for those researchers who are working on any COVID-19 related research. Collaborative team science is central to the N3C's mission. Researchers work in teams by either joining an existing team or starting a team and inviting other researchers and scientists. This is a free resource to University of Utah researchers. N3C enclave data is electronic health record from data contributing sites with the following inclusion criteria. All lab confirmed positive and negative COVID-19 cases. All patients with COVID diagnostic code with no lab. Patients with symptoms that shows a possible positive. There are no demographic restrictions. Start date is January 1st, 2020, with a look-back period from January 1st, 2018. Data from individuals infected with pathogens such as SARS-1, MERS, and H1N1 is also included. For further information about the National COVID Cohort Collaborative, visit covid.cd2h.org. For information about this resource and other resources, visit ctsi.utah.edu/course-and-services/BMIC. For inquiries and access to N3C Data Enclave, email us at help@ctsi.utah.edu.